Hi, everybody. I'm Joanne Kurtzberg, and I'm director of the Carolinas Cord Blood Bank at Duke, which is another one of the NCBI banks, also president of the Cord Blood Association, and I'm speaking today on behalf of the NMDP Cord Blood Advisory Group. So we all know that COVID has emerged as the most important pandemic of our lifetime, and specifically related to cord blood banking, there are questions related to whether pregnant women and their fetus can transmit, or if there's transmissibility of COVID-19, either from mother to baby during pregnancy, which would be vertical transmission, or whether there's presence of virus in the cord blood of a baby born to an infected mother. And although not all these answers are known today, I'm just going to review some of the information we have. SARS-1 was shown to be vertically transmitted, while MERS was not. So these coronaviruses don't always behave the same way. The limited evidence we have for COVID-19 in pregnant women in their last month of pregnancy suggests that there's a very low rate of transmission from mother to baby. The current cord blood public inventory, I think, is at extremely low risk of transmitting COVID-19 to a hematopoietic stem cell transplant recipient for two reasons. One, most units are collected before COVID-19 existed, and two, recent donors have been screened per FDA recommendation. I reviewed the literature, and this slide is now updated from last week. There are 108 case reports that I could find in 9 recent reports in the literature. Many of them were from China, but not all. And most were term pregnancies. There was one 31-weeker in the new cases I found. All of the mothers in these reports had documented and symptomatic infections at the time of delivery. The majority of deliveries were conducted by a C-section, and the majority of babies were separated from their mothers at the time of birth. As of last week, there were no infections documented in any babies, but I since have found 3 reports of neonatal infections in the 108 babies I mentioned. In all cases, the babies were mildly symptomatic with respiratory symptoms and fever, and all babies fortunately recovered and were discharged by 2 weeks of age. In several cases, there was testing of blood, throat cultures, and other body fluids from the baby, and other than these 3 babies, they were negative. And in one case, there was testing of breast milk from an infected mom, and that breast milk was tested and negative. And I'm happy to provide the references for these infections. Early on in the COVID epidemic, the FDA issued recommendations to enhance donor screening through the donor screening questionnaires to keep the supply of cord blood that was donated safe. And we implemented in our bank 2 modifications, one on March 3rd and one on April 5th, and they're listed on the slide. But these are questions that were asked of the mother who was the potential donor of the baby's cord blood. And the first is, in the past 28 days, have you traveled to areas with COVID-19 outbreaks as defined by the CDC? Yes, no. Now that obviously was the question, part of the questions that came out on March 3rd, because now all areas of the world are considered high risk. The second question, which was modified on April 5th, is in the past 28 days, have you cared for, lived with, or otherwise had close contacts with individuals diagnosed or suspected of having COVID-19 infection? Yes, no. And the third question, in the past 28 days, have you been diagnosed with or suspected of having COVID-19 infection? For the first question, I can tell you in our bank, we review that by the medical director, who happens to be me. And then for the other two questions, we defer that donor. We've also instructed all of our cord blood collectors to not go into rooms where the mother has been marked as suspected of or being tested for COVID-19, and certainly not to approach moms who have had COVID-19. I know it's different in every hospital, but in our general area, the COVID-19 suspected or proven infected patients are being hospitalized in distinct parts of the various hospitals. Now, you've heard both from David and Marcy many of the impacts on cord blood bank operations. I'll just mention a few in a higher level sort of overview and talk about innovations that we made in our bank to continue to enable recruitment of donors, consenting of donors, and collection of cord blood. So first, with the goal of preserving social distancing, we made a new rule that we could only have one collector in our collection room at a time, which meant that we had to be creative about our scheduling because in the past we had often more than one collector in the room at a time, and the rooms are small and do not permit social distancing. So for creative shifts, we asked people to change their schedules and cover different hours and enabled working from home whenever possible. To that end, we minimized physical contact with the maternal donor. So we have our on-site collector wave at the door saying hi to the mom in a mask, etc. She leaves the paperwork for the consent and also the maternal and family history questionnaires with the nurse who gives it to the mother. She or he then arranges to have the collector who's working from home call the mom in her hospital room to go over the consent and also to go over the questionnaire. And we had to, with our IRB and our quality group, figure out a different approved method of signature for these consents. Then the nurse returns the signed consent to the collection on site. We've also allowed our review team to review batch records at home, which is against what our usual policy of not taking anything off site. But it enabled more people to work productively and maintain their presence at home. We've also always maintained clean environments, but we added IPA wiping to all common counters, doorknobs, elevator buttons, common surfaces. Duke has provided masks for all employees, and then we've increased our own awareness of the hospital layouts to avoid any mother suspected of having COVID or being actively infected with COVID. I will mention our staff, our collection staff and reviewing staff is about 60 people, and we did have one collector develop a COVID infection. She was not on site when she became symptomatic. Her coworkers that she had been exposed to over the prior week were all tested and negative. She fortunately recovered without any sequelae, but we did have it touch our group. You heard a lot today about the impact on cord blood transplantation. One thing that NMDP did, which was greatly appreciated, I think, by the cord blood banks, was to recommend that all potential recipients have a backup cord blood unit worked up just in case something happened to their unrelated adult donor. And that was announced in the April 2nd newsletter and has been re-announced in many of their promotions. There also was, as you saw, increased use of cord blood donors in March, and it was especially for international patients. And we don't exactly know why that was, except that COVID was ahead of us in Europe. And I can tell you in our own bank where our shipments for the year have been down. In January and February, we shipped only 6 units each. In March, we shipped 18 units. And in April, we're up to 14 units. So we have seen a small increase in the number of units we're shipping. And we're quite sure it's related to the pandemic. You saw this slide earlier today, so I won't go over it. And this is just the data from that slide showing that in March in 2019, NMDP shipped or performed 475 I'm sorry, I have the wrong thing circled. They shipped 54 units, and in March of 2020, they shipped 69 units. So again, that little increase that you saw presented this morning. There are other uses of cord blood and birthing tissues to treat COVID-19 that are emerging in clinical trials. And again, it's one of the alternative uses of cord blood, but illustrates the point, at least from my perspective, that cord blood banks have the infrastructure to procure safe, well-screened GMP products that can be used for other manufacturing. And there are studies going on now using cord blood-derived NK cells, cord blood-derived CTLs, and cord blood CAR NK that are being targeted towards COVID. For cord tissue, there are a number of studies emerging using cord tissue-derived MSCs to treat COVID-associated ARDS, and that is also true of placental tissue. And although I didn't put on my cord blood slide, it's also true of bone marrow. And the early studies look encouraging. So in summary, I wanted to just make one other point, which is that some cord blood banks have decreased or suspended their operation during these shelter-in-place or isolation orders, and that will predominantly impact collections. The HRSA accrual goals for the NCBI banks may be delayed, and I'm hoping that HRSA can figure out a way to extend the 2020 accrual deadlines, maybe to combine those targets with the 2021 targets to give banks a chance to catch up. Otherwise, COVID-19 occurring in the last month of pregnancy has a low to negligible rate of vertical transmission with the available data. And infants born to mothers with active COVID-19 appear to do well. Cord blood banks can screen donors through medical history questionnaires and on-site PCR tests when they become available at the collection site, but the utility of that may not be as great as the actual screening questionnaire. I suspect testing of donors will be implemented in the future to assess COVID exposure earlier in pregnancy. That's particularly if antibody tests are available, but we'll need more information about vertical transmissions to know how to use that data. Safe practices at collection sites can continue to enable ongoing donations and collections, and additional information is needed to determine the full impact of COVID-19 on cord blood donation and banking. So thank you, and I'm happy to answer questions with the other members of the session.